So today, we will, in the wake of Salt Awareness Week and World Hypertension Day, Sakhisizwe is addressing the topic of health as it relates to cardiovascular diseases, otherwise known as CVDs. According to the World Health Federation, CVDs, commonly referred to as heart disease or stroke, are responsible for about 18% of deaths of non-communicable diseases in South Africa. Although people are at elevated risk of having CVDs if their family has a history with them, this is just one component that contributes to a person's overall risk of developing them. Fortunately, there's many lifestyle choices that you can make to reduce your risk. To get an understanding of what those choices are and also what resources are available out there for people at risk of CVDs, Sakhisizwe is speaking with a representative of the Heart and Stroke Foundation. How are you today, Kinza?
I'm doing well, thanks. I hope you and your listeners are doing well too, and thanks for having me on today.
And it's only a pleasure to be speaking to you. Kinza, so as most people are aware of the focus base of Heart and Stroke Foundation, so we're not going to go into the whole history of Heart and Stroke Foundation, and we've spoken to you numerous times. So if you can just like when we do speak about hypertension, it is quite vital to have this conversation, and also this week serves as Salt Awareness Week. So if we can just talk about the importance around Salt Awareness Week and also World Hypertension Day for raising more awareness around cardiovascular health in in South Africa.
Yes, no, definitely. So as you rightly said, May we commemorate Salt Awareness Week and World Hypertension Day, and they're both two very, very significant campaigns because, it's been well established that there is a very strong relationship between excessive salt consumption and hypertension or high blood pressure. So you can't talk about the one without mentioning the other. And particularly if we look in the South African context, in South Africa alone, more than 1 in 3 adults actually live with high blood pressure, and it's been found to be responsible for 1 in every 2 strokes and 2 in every 5 heart attacks. And I think it's very important to speak about it because it's known as a silent killer because there's usually no visible sign to actually warn you that you have high blood pressure. That's why it's been found that more than 50% of people with high blood pressure actually unaware of the condition. The only way you can actually know is by getting your numbers checked. And on that, as a foundation, we go out and we actually do screenings. And one of those screenings include blood pressure. And what we found in most settings is that an estimated 20 to 30% of individuals have high risk parameters. And majority of these are borderline to stage 3 hypertensives, which is one of the most crucial or, critical stages of hypertension. So it's definitely a huge problem in South Africa, and the numbers are reflecting this. So it is a very important topic to speak about, and obviously then in that comes what causes it and how can we manage it, and that's where SALT comes in as well.
Definitely. Kinza, and as you know, here in South Africa, the population is quite obese, which actually contributes to hypertension. And the younger individuals are also diagnosed with high blood pressure. So when we do speak about high blood pressure, what is the estimated number supposed to be before you need to rush to an emergency or a healthcare facility?
Yes, so our ideal blood pressure we want it to be is at 120 by 80 or 120 over 80 millimeters mercury. And I think, it's just very important to understand these figures. Okay, so the first figure, which we ideally want it to be at 120, that is the number that represents the pressure in our blood vessels when our heart beats. And the second number, which we want to be 80, is the pressure that is represented when the heart is resting between the beats. So ideally, we want it to be 120 over 80 millimeters mercury. Someone would be diagnosed as being hypertensive if we find a higher than normal reading on repeated measurements. And so an example of that would be 140 over 90 millimeters mercury. So what we usually do is if we find anyone, over 120 by 80, then in the communities, then that's when we'll start counseling them. And obviously the higher we get, definitely if it's over 130, then we'd refer them to the clinic. And 140 over 90 would be something that, we'd say is very crucial for them to immediately go get themselves checked out.
Yes, and so I'm actually curious as to, can you elaborate on some of the important dietary changes in reducing the risk of cardiovascular disease?
Yes, so when we look, at cardiovascular disease as a whole, there's many risk factors. Hypertension or high blood pressure is one of them. And obviously our campaign in this month is focusing on that. But as was mentioned, obesity is another risk factor. High cholesterol is a risk factor. Even, being diabetic can put you at a risk of experiencing any heart-related condition. So in essence, what we then need to do is we need to actually manage all these different conditions. So obviously, depending on the condition, there's different dietary advice that we would give. If we look specifically at hypertension, one of the biggest thing is salt. So we know that excessive salt increases our blood pressure. So then we ask the question, well, then how much salt can we actually consume? And it's recommended that it shouldn't be more than 5 grams, which is about a teaspoon of salt from all sources per day. That includes when you're cooking, at meal times, and it actually starts when you go shopping, the products that you purchase. So it's very important to be aware of how much salt are in the products that we're purchasing from the shops. And that's where things like reading food labels, understanding your nutritional table and the ingredient list comes into play. But of course, still on hypertension, there's other factors which, we speak about diet. Diet is very, very important. But it will only work if you bring in other factors as well, other behavior modifications. For example, making sure that you're exercising regularly, and not smoking, because that also has a huge role to play in increasing your blood pressure. But like I mentioned, that's specifically for blood pressure. We can speak a lot more when it comes to the other risk factors, like high cholesterol and diabetes, as I mentioned.
And you still tune into Sakhisizwe, Building the Nation, Bodinasi. We are speaking to Kenza from the Heart and Stroke Foundation, and today we are focused on Salt Awareness Week as well as World Hypertension Week, or Hypertension Day. Kenza, you've mentioned to change your dietary, but it's not always, or it's known, especially on the Cape Flats, that it's not so easy to do that, because the illusion that is created when you do speak about living a healthier lifestyle, it means it's going to be costly. So is there maybe a few tips that you can convey to us today, how people can use what they have at their disposal to change or to live a healthier lifestyle without it being cost effective, and also taking in account when you did speak about checking the labels, is there an easier way how to read the labels, as everyone don't always know how to read the labels at the back of the product, because as you know, if you purchase something, it's a lot of information on that product, but it doesn't actually tell you if the thing is healthy or not healthy if you don't understand what it is that you're reading.
Yes, no, very good point. Thanks for that. So, it's completely understandable. Sometimes you can only tell someone so much, you need to purchase healthy options. And sometimes it is true that, unfortunately, the healthier options do tend to be more costly. There's definitely some, foods out there which people don't always know that, you can use this. These are healthy. Or even just the way that you're preparing them, or things like portion sizes can assist in ensuring that you're using your ingredients in a cost-effective way. But having said that, we definitely don't hide away from the fact that things are expensive, and sometimes you need a more public-based intervention as opposed to just educating the individual. And that's one of the reasons why South Africa actually has a salt legislation in place, which looks to reduce the amount of sodium across a variety of processed foods. And these are foods which are known to be purchased by a lot of South Africans. So the idea is to try and just get the population at large to reduce the amount of sodium that they are consuming. And that is, in essence, one of the ways of trying to reduce, trying to address that problem of the fact that some people can just afford, the foods that are not always very healthy. In terms of understanding, your food labels, that's also a very important point. And that's one of the reasons why we at the foundation have a heart mark endorsement program where we analyze food products, to make sure that they don't have too much added salt, they don't have too much added saturated fats, and they don't have too much of the added sugars, as well as being high in fiber. And if we find, that a food product ticks all those boxes, then they get our heart mark logo. And it just makes it easier, like you said, for people that maybe cannot understand all the complicated labels or all the words that come with a food label. Just seeing that heart mark would tell them that, okay, I can buy this product. Ideally would be good for me and my family, our heart health. But having said that, it's also, there are some ways in which you could quickly just check if a product is good. If we just focus on salt only, I can mention just one thing. When you go shopping and you take a product and you just turn it, you go and you look at the ingredient list and you just check if salt is listed in the first 3 to 5 ingredients. And if it is, then that means that product is packed with salt. And sometimes they don't just put salt. Sometimes they'll write sodium, or they'll write MSG or nitrate or nitrate. So any of those words in the first few, at the beginning of the ingredient list would tell you that it's high in salt and you need to avoid it. I think it's always important that when we're looking to see what foods we need to purchase, that we see which of those products we can afford that are perhaps in season, specifically for the fruits and vegetables. But there's lots of foods that you can purchase that can last you long, like your lentils, like your beans. There's always a question about canned foods like canned fish, canned beans, canned vegetables. The question always pops up, well, aren't those products high in salt? They usually are, but more cheaper and more convenient for most people. And we say that it's perfectly fine to use those products, to just give them a bit of a rinse before you use them so that you get rid of that excess salt. So a little bit of knowledge of which foods you can purchase, which are maybe affordable, a little bit of knowledge of your food labeling, all of that over time. A few of those steps can assist with watching our salt consumption.
And I'm curious as to if the foundation has faced any challenges in advocating for salt reduction and promoting cardiovascular health in South Africa.
So I think, we obviously, as a foundation, our aim is to halt the rise of premature deaths that occur from cardiovascular disease. So it's something that's ongoing. And obviously there will always be challenges, whether it's, as we mentioned, to do with cost. And in that case, then you have to look to work with other similar minded organizations. And that's one of the reasons why we've been at the forefront, when it comes to salt legislation. We've led many salt reduction campaigns. We've worked with National Department of Health. We understand that it's important to collaborate, to make partnerships to try and achieve the same goal when it comes to reducing cardiovascular disease in the country. But we're a great team that, we go out into the communities. Specifically, a lot of the times it's communities which maybe can't always get their numbers checked easily. So that's when we would go out and assist with the screenings, and then refer them to their nearest clinic. And challenges that we'd face would be things like they can't afford the right foods, or perhaps they don't understand what the link between heart disease and diet is. So it's every day it's a learning curve for us as well. But we definitely are seeing over the years, that people are becoming a lot more aware of what these conditions are, and it's important to just bear in mind that it requires collaborations, and it requires individual-based education as well as public interventions, like I mentioned.
Thank you very much, Kenza, for taking the time to speak to us today. And like you've mentioned, there's a lot of factors at play, such as diabetes also being one of them, and also taking in account stress that people basically endure on a day-to-day basis that contributes to hypertension. But you've mentioned there are healthier options also, how to change your dietary and live a healthier lifestyle. So just in conclusion, what are the long-term goals for the Heart and Stroke Foundation in terms of reducing cardiovascular disease further from here on? Like you've mentioned, you do go out to the communities, you do public screenings, and if you see something isn't right, you do revert them to a healthcare facility. But and also what you've also done, like you've mentioned, is your label or the Heart of the Heart and Stroke or the brand of the Heart and Stroke Foundation is basically on some of the products that basically indicates that this is a healthier option.
Yes, yeah. So we aim to continue doing that, to continue, reaching out to all those communities that perhaps don't necessarily know the link between heart diseases and, just your day-to-day living, your diet, exercise, relationship with smoking as well. And we also, our aim is to reduce the numbers of heart disease, but also strokes. I think strokes is also another very important topic, which I think now over the years we've been focusing on it a lot, and people are becoming more aware of it as well. But that is also something that we see in the near future of trying to educate people on what the signs and symptoms of strokes are, because that's also something which if you pick up, before it's too late, you can actually prevent a lot of damage from happening. So I would say that would be our long-term goals, is to build on reducing the numbers of the burden that cardiovascular diseases places in the country, but also just to keep on raising awareness on strokes as well.
And just to close out the interview, do you have any final words, and also how individuals, communities, and policymakers can also support the efforts of the foundation in combating cardiovascular diseases and hypertension?
Yes, so I think my closing statements would be just, we're always focusing on diet when it comes to all these risk factors of cardiovascular diseases and strokes, and it's very, very important. But as I mentioned earlier in my interview, it comes along with other behavior modifications, such as exercising, figuring out what type of movement you can do, you specifically can do in the day. It doesn't have to be anything fancy, as long as it's something that gets your heart rate pumping. I think, in this day and age where screens have become so easy to access and we all day on our screens, I think it's important just to bring that reminder in that moving our bodies is equally important as having a good diet in our everyday lives. And also to stay away from smoking, whether it's tobacco smoking or vaping, because that also has a major effect on the heart disease and stroke numbers that we see. And the public can reach out to us on we have a health chat line. We're always willing to collaborate with new organizations, as well as just interact with the public, and the number for that is 021-422-1586. And other than that, you can follow all that we're doing on our website, www.heartfoundation.co.za, as well as all our social media pages on Facebook and Instagram. as well as LinkedIn.
Thank you so much. It's been a pleasure speaking with you. I really learned a lot from the conversation that we had today. Goodbye.
And Kenza, just before we let you leave, you've mentioned that number is 021-442-1586.
No, 021-422-1586.
Okay, awesome stuff. Thank you very much for taking the time to speak to us today. Have a beautiful day further. Bye.
It's a pleasure. Thank you.
So that was Kinza Hussein from the Heart and Stroke Foundation informing us a bit about exactly what is the importance of Salt Awareness Week and World Hypertension Day, which we're acknowledging in May, and telling us some specific things that we can do to manage our risk of cardiovascular diseases, as well as some of the things that the foundation does. So thank you so much, Kinza, for informing us on all of those things. Yes.
And if you want further information, you can just visit the website www.heartandstrokefoundation.co.za. They are on social media as well. So right now we'll go into the isiXhosa news at 1 o'clock with Isobusi. Keep it locked to Bush Radio 89.5 FM.